Good evening, everybody. Going to give people a chance to get into the room here before we get started, but welcome. All right, I'm going to get started here. So, welcome to the first seminar of the One Health seminar series for the spring. We have 5 more following this up this spring, and so we hope there'll be a little bit of something for everybody. For most of you, you probably have attended a One Health seminar in the past, but for those of you who are new, I just kind of let you know where we're coming from here at delval related to One Health. And I try to put it in simple terms here. We've got one planet, and we're all in this together, whether we're talking about the environment, whether we're talking about humans, or we're talking about plants and animals. This is nowhere for us to go, so this is where we've got to make our stand. One Health is recognizing this, and here at delval, we are trying to get this concept across, not to just those folks who may be working in animal-related fields or in the environment or within public health, but to every single major on campus. It's a transdisciplinary approach, and if nothing else, it helps us to learn to listen to each other. It is much better in your working lives. I think you'll learn this very quickly, that you come out of your universities or whatever with a particular degree in a major, but that major by itself is not going to solve the problems that you're faced and what we're faced with in the world, either at the local level, the regional level, the national level, and certainly not at a global level. We need to interact with other disciplines. We'll do a much better job of tackling our problems. You'll be a better world citizen if you keep in mind that everything that you do in your life also has an impact on the other elements of the One Health triad. Uh, Formal definition, transdisciplinary systems approach, because the system is the planet, the ecosystem, those physical and biological components of it that are working together. And when things aren't going so well, those can result in problems for each of the members of that triad as well. At delval, we try to approach this from a couple of different directions. One is through education. We introduced the concept within our first year through our delval Experience 1 and our 2 in particular, and also in many of our courses across many departments. We have a minor in One Health Communications because we feel it's so incredibly important to be able to get information out, not just to people within the particular discipline, but everybody, and being able to communicate what it is that's happening in our world and how we all need to work together to be able to address those problems. Encourage student research as well, particularly if it can be transdisciplinary. Love to see more projects in which we see students from different departments working together towards solving a common problem. And then finally, outreach. And that's what these webinars are all about, is outreach. We've been doing this since 2015. Coming up on 10 years this coming fall that we've been offering these seminars. And these are not just for every student on campus and our faculty, but it's for our community as well, because we are a part of the community and we need to address things together. And hopefully delval's a better neighbor through these seminars. At this point, I'm going to stop my sharing because I'd like to introduce our first speaker for this spring semester, who is an incredible opportunity for us to get to have a conversation with Dr. Lichtveld. Maurenn Lichtveld is an MD. She's also got a master's in public health. She is Dean of the University of Pittsburgh School of Public Health, the Jonas Salk Chair in Public and Population Health, and Professor of Environmental and Occupational Health. She oversees 7 academic departments with an annual research portfolio of close to $100 million, and more than 1,200 students, 165 faculty, and 320 staff. With more than 35 years of expertise in environmental health, her research focuses on environmentally induced disease, health disparities, climate and health, environmental health policy, disaster preparedness, public health systems, and community resilience. Dean Lichtveld is a member and vice chair of the Council of National Academy of Medicine. Honors include Johns Hopkins University Society of Scholars, CDC Environmental Health Scientist of the Year, and Woman of the Year of the City of New Orleans for contributions to science. And she happens to be our head of the Pennsylvania One Health Consortium, and I'm sure she's going to talk a little bit about that. And Delval is very proud to be a component of that. Dr. Lichtveld, the stage is yours, and thank you so much for being with us. You're on mute, Maureen. Still muted.
Okay, can you
now
hear me?
There you go.
And then I will share my slide set.
And remember, while Dr. Lichtveld is bringing up her presentation, at the end we will have the ability to look through questions. So Q&A is on your screen. If you have any questions, please put them in there. We will try to get to them, as many as we possibly can, by the end of the presentation.
Can you see my slides?
Not yet.
Oh, okay. Let me stop this.
This is kind of the working principles of Zoom webinar, is whatever can go wrong will go wrong. And even with practice sessions, it always ends up being a challenge at times here.
Can you see anything now?
Not yet.
All right, how about now?
It looks like it's coming up now. And so now we're seeing both your introductory slide and your other slide. So you're not in presentation mode yet.
Okay,
there
how about now?
Perfect.
All right. Well, good afternoon, everyone. I'm excited to be your first speaker, and even more excited to be talking about One Health. And so, when Professor Hoyt asked me to join, I thought immediately of the title, so One Health, and what does public health have to do with it? So let's see what public health has to do with it. I'll take you a bit to public health. And here are, over the history of public health, our 10 greatest achievements. And I want you to notice so many of these 10 greatest achievements are related and very much connected to One Health, whether we're talking about infectious disease or vaccine preventable diseases, about maternal and child health, about occupational safety. We'll talk about kettles and H5N1 in the middle. And above all, about public health preparedness and response. And so let's examine each of these areas and see how One Health fits. You've already heard about the definition of One Health, so I will skip that. But what I do want to point out is that One Health brings together, as Professor Hoyt mentioned, the sectors and disciplines, but also us, the people, the society, together, but together through those 4 C's of communication. How do we work collaboratively, of collaboration, of coordination, and of capacity building? And I will come back to each of those. And so how does One Health fit? If you think of human health and animal health and plant health and environmental health, All of those are components and domains, so to speak, of One Health. And on top of all of that is climate change and the influence of climate change on One Health. Now, when I teach, I call this is the impact of climate change on health from the Centers for Disease Control and Prevention. I call this the wheel of death when I teach here at Pitt. Why? If you go, imagine this is a pizza. And if we go from the inner side of the pie to the outer side, the first part is the inner side, where you see the climate drivers. So whether it's more extreme weather or rising sea levels, something that we deal with in many parts of our country, including in New Orleans, where I spent almost 15 years, increased levels of carbon dioxide, and rising temperatures. And of course, we each experience some of that, even though we have winter right now. Now, if you go to the next slice of the pie, you see the environmental drivers, whether it's changes in factor ecology because of flooding or drought, whether it is more severe weathers or extreme heat. Those are then the mediator, so to speak, the media, the Ubers and Lyfts of the world that ultimately then impact health. Particularly if you look at vector-borne diseases like malaria and dengue, we clearly see how One Health is so core to what happens in our health, in animal health, and in plant health. And so let's look further. When the world reached 8 billion in population, I was asked, what keeps me up at night? Now, I often tell people what keeps me up at night is I want to make sure my grandkids are healthy. But what keeps me up at night from a work perspective are these 4 areas: infectious disease, extreme heat, food and water security, and poor air quality. So each of these 4 things that keep me up at night are integrally related to environment, or to environmental health in specifically, but very, very pointedly to One Health. Now, follow this circle with me. Let's take 2 of those climate drivers. On the left, increasing temperature and changing precipitation, so more rain or less rain. That has direct influence of the vectors. In this case, it's the mosquito, leading to often an increase in vector-borne diseases impacting us, humans, as well as non-communicable diseases. Malnutrition is an example of that. It's a condition that ultimately is influenced by decreased food. And then leading particularly, as Professor Hoyt said, the impact on people who are already experiencing health disparities. And whether they're here locally in Pennsylvania or whether they're anywhere in the world, particularly in lower and middle income countries. So let's look closer to influenza viruses as an example. We know that there are many hosts in our animal world of influenza viruses, and we are one of those. Now, there is a special kind, like a cousin of the main influenza virus, in this case in wild birds. And we wanted to, as we do in public health, we do a lot of surveillance work. We wanted to see what's going on in all the 50 states. And you wouldn't be surprised, I'm focusing on our state, Pennsylvania, that we too have this variant of the H5N1 in Pennsylvania in our wild birds. You could see the number of 141 in there. Now, the next thing we want to look at is closer to where we are and what we do, the US poultry production, both the commercial production as well as people who have in their backyard, a few chickens that they grow and they eat from. And you can see that for Pennsylvania, we have both commercial flocks as well as backyard floods. So we're very much in the mix when it comes to risks. Now, if we look at the next group of, and so as you could see, the more we look at data, the closer it's coming to us. So now we look at dairy cattle. Fortunately, and we are crossing our fingers and being very vigilant, we do not have cases in dairy cattle in the state of Pennsylvania, but you could see right next door to us, there are cases in Ohio. Now, as I mentioned to you before, there are many animal species that are infected with, in this case, H5N1. And so not only the ones we've looked at before, the wild birds and cattle, but they are in wild cats, there are in domestic cats, in bears, in raccoons. And last week, I am part Dutch. I had a message from a colleague who said a fox who ate a wild bird was contaminated and was roaming around a water supply in the dunes in Amsterdam. So very much close to where people live. Now, cats have a really important role to play here in terms of transmission. Not a good role, but this is happening. So we started with seeing emerging infections of H5N1, of this particular kind of H5N1 in cats. And initially what we were seeing is that it's in many organs of the cat, but particularly if you look on the right-hand side, for those of you who love biology, these are histology slides colored with H&E. And so you could see impacts if you follow the black arrows in the brain, in the lung, in the heart, and in the retina. So it's all over. So this is a multi-organ disease for cats. But let's look further. So when we initially looked at a big group, so a colleague of mine here, Dr. Kuchipudi and his team, looked at what's happening with cats around these initial major exposures and major transmission and death of cats. We saw that initially cats were dying, but then we saw that some cats showed clinical symptoms. So some cats were sick, but they didn't die. And then we saw that cats who were in very close proximity with other cats who were actually sick appeared to be healthy. Now, this is what is an increased risk, because that means there are changes happening in some cats that make them somewhat resistant to that particular type of virus, or variant of virus, I should say. What is most important to note is that those changes begin to come closer and closer to us as humans. And this is a very recent publication. So now, how do cats get involved if we continue to think about the virus being transmitted from wild birds into cattle? So how is it that we're getting cats, the transmission is happening in cats? This is our state, Pennsylvania. And if you didn't know that, we have many locations that still sell raw milk. Now, I'm pointing out Region 4. That's where I live, in Allegheny County, one of the counties in Region 4. And there are 25 locations where you can buy raw milk in this region of our state. Now, there are people who believe that drinking raw milk is healthy. It is not. We know from the history in public health that you boil the milk, you pasteurize the milk, so that any bacteria, or in this case viruses, are dead before you drink it. The fact that we still have raw milk on the shelves, and in 25 locations only in the region 4 already, is very worrisome from a public health perspective. So now, as we mentioned before, the closer animals get to humans, the closer we know that there are changes happening in their genetic profile, the more we are worried about animal to human transmission. And as you could see, just for H5N1, the number is much higher if you take all viruses together. It is 67 cases in 10 states, and we know that a month or two ago, the one case in Louisiana, that person died. Most of these transmission are in people who worked on dairy farms, so more of an occupational exposure still. So characteristically, then in public health, we say this is low risk. But as the virus changes, we are at higher risk of exposure. So let's look how this happens, the sequence of how this happens. We went from wild birds, and then something happens with the gene, and it's in a fancy way, it's called genetic reassortment. So the gene of that virus changes, it goes into other birds, but birds that are getting, and animals that are getting closer to us. And you could see the sequence from a bird in Miami, in Wyoming, then in California, and then in a squirrel, or in some animal that looks like a squirrel, I think it is a squirrel, in New Mexico. Then another change happens in an unknown host genetically. And so we go from wild birds to domestic birds, these are doves, to cattle. And then from cattle to other larger mammalian species. These then contaminated cattle were transported by truck from, in this case, Texas, that's where we first started, and then spread through many states. Those contaminated cows then infected some of the workers on cattle farm. And then ultimately it's getting closer and closer to us. So you see that sequence of events. So now, as I shared with you before, we're still at relatively low risk because it's primarily in people who work at those farms from an occupational perspective. However, we are very vigilant within public health to watch for another pandemic. We had one with COVID-19. So how does a pandemic occur? There are 3 conditions that must be satisfied before one occurs. The first one is we either have a brand new virus, or, as I mentioned to you, it's just like I would change my my off-white jacket to a red jacket. There is a change in that virus, that genetic reassortment happened, but we had not seen, our immune system hasn't seen that change before. So we're not protected. We can't really build a response, build a defense against that attack. The second important condition, and that has not been satisfied yet in the case of avian influenza, is it's easily spread from person to person. So if I cough, if I sneeze, I can infect you. The third very important condition is that it has to cause serious illness or death. So if I get pain in my little toe from being infected, that's not a big deal. So for a pandemic to be declared, each of these 3 conditions have to be in place. So let's look, remember how we started with talking about the major achievements in public health? Let's look at where we are with the key childhood vaccinations and other vaccinations. We'll talk about herd immunity a bit, but if you look at the numbers, the childhood vaccinations of diphtheria, tetanus, pertussis, and polio, as you know, polio is the polio vaccine, the Salk vaccine was developed at Pitt Public Health. They are below the percent, the rate that we need to have herd immunity in place, and I'll talk about herd immunity in a bit, because that worries me a whole lot. And so if I just take a quick look at all the vaccines, I worry how low the coverage is. Now I want you to look at, this is the medical and non-medical exemptions where people do not get vaccinated with, and this is their reasons. I want you to look at our state of Pennsylvania where the red arrow is. You could see it's a little small, but if you could see that there are very few, that lighter blue for Pennsylvania, so there are very few cases of true medical exemption. There are a lot more cases of one or more vaccinations not being taken, that being exempt. And the remainder of the exemptions are for non-medical reasons. And so while we're not as bad as Idaho, we certainly want to be closer to Maine or Connecticut, and we're not. So what are the consequences of that? And as you know, we have measles outbreaks, we have meningococcal meningitis outbreaks in students, in college students. So I hope you are vaccinated if you are a college student, and if you're a community member, absolutely be vaccinated. So why is that important? If we, in normal circumstances, when we follow public health guidance, when we follow the evidence that we have that vaccinations work, vaccinations are protective, then we have herd immunity, meaning that picture on the right side, if more than the number that we're looking for is around 96%. So if about 96% of all those green little, stick figures here, if they are immunized, if they are vaccinated, then we can protect the ones that are susceptible. We can protect the blue ones, even if we have one or two infected people. This is really important. But if we don't have herd immunity, that means the numbers, the rates that you saw of 80%, 70%, 92%, then what's happening is that this one infected person, the big figure in the middle, I'm now on the left-hand side, can infect many more people because we don't have enough green little people around us. So the bottom line is the decision to vaccinate or not to vaccinate is not about you as an individual. It is about you putting your whole community at risk, whether it's a community of students or your own family. And so we have in public health, we have an obligation to not only protect ourselves, but by protecting ourselves, protecting our whole community. Now, there's been a lot of talk, and I still mask when I fly. I still mask when I'm in airports. I mask when I'm in big crowds. There's a lot of talk about, well, did mask work? Or should I just put it on? Or have you, I'm sure many of you have seen people putting on their mask and putting it below their nose rather than on their nose, or putting it below their chin even, and putting it under their chin, as if it was a new necklace. And so the type of mask are very important to what protection they give. And so if you look at the type of mask, just a cloth mask only helps you protect you for 56%. Then you'd have the surgical, those blue masks at 66%, but you really want to have an N95 or a KN95 that protects you at 83%. But there is no mask that 100% protect you because you still have some areas where your breathing is coming out. Now, what does it mean for public health? It means that if you have infected cows or infected chickens, that there is less of a safe, fewer safe eggs and chicken meat and beef to eat. It also means, from a human perspective, that human workers can transmit to the general population, and we talked about it. In addition, there is a phenomenon called super spreading. Here is where, if you look at the people in red versus light red versus dark red, you could see that one person, the person in the middle, the light red person in the middle, has, for some reason, the ability to infect many more people than the other light red person on the left. And so that notion, that indeed happened during a very first H5N1 pandemic around 2005. And so, and we have not enough herd immunity, and we have the phenomenon of super spreader. So together, our chances or risk, the probability to get infected, the probability of transmission is so much higher. The World Health Organization defines 6 pandemic phases. And so here you see those phases. What's critical is for us never to go beyond phases 1 and 3, because phase 4, when you have sustained easy, as we talked about before, human-to-human transmission, is when a pandemic is declared. And you could see that after phase 5 and 6, we have some peaks, but we have some infections, but we really are past the peak. What is important from a public health perspective is we have to have some time where none of this is happening for us to build back up our immune system, whether it's in humans, in animals, or in the environment. And with back-to-back pandemics, we don't have that opportunity. We also don't have that opportunity, and we'll talk about it later, building up the public health structure, the public health infrastructure to help us address those pandemics. So let's leave viruses and go to ticks. I was told, perhaps a bit jokingly, but I took that very seriously. Pennsylvania is either number 2 or so of tick-borne diseases, that instead of, the next time I introduce myself, instead of saying I'm from Pittsburgh, I should say I'm from Ticksburg. So here are some of the ticks, and you could see our state being very dark green in terms of prevalence. And here you see it, the last data we could get out of CDC was between 2019 and 2022. And so you see the cases, particularly of Lyme disease. This is what public health does. We do consistent surveillance and monitoring so that we know what actions to take. And you see the actions on the right-hand side. Public health is involved very much so, very prominently in the first 2, because if we do awareness right, and if we do prevention right, then we have fewer to diagnose, to treat, but while we're continuing to monitor risks. Okay, so now let's go to another part. As I mentioned to you, food systems. I'm worried about food insecurity. Let's look at what some climate drivers can do. The two we talked about was high temperature and precipitation. So let's imagine we have, we don't have to imagine it. In areas where we have higher temperature and either less, so drought, or more precipitation, flooding, regardless which climate driver you take, ultimately, we will end up with using more pesticides. More pesticides get deposited, and if we have drought or flooding, more pesticides is applied because you need to increase your yield as a farmer, leading ultimately that an increase in pesticide residue in produce, the things we eat, particularly the leafy vegetables. So this is part of my team's research in Suriname, where I come from. As you can see, not everywhere, particularly in lower and middle income countries, is personal protective equipment well used and well applied. There is often one water source that's used to, and these are rice fields, where you have vegetables going on, where pesticide is being sprayed to grow the vegetables, but also as a source for taking a shower, taking a bath. So here are some of the research that we've done. We've looked at pesticides residues in leafy vegetables, in legumes, in fruits, as well as in grains. So we also looked at it in rice. And here's what we found. We found pesticides, first of all, that are forbidden, are embargoed, are no longer being used, should no longer be used worldwide. We found still those residues in some of the leafy vegetables, particularly. We found some that were higher than the level that can be harmful to your health. Here are some of those levels that you see are of concern. And look, I want you to look at Tanya. And Kailan. So then we did a survey. We asked community members, particularly pregnant women, what is it that you eat? And 97% of the people we surveyed, it's about almost 1,000 people, said, yes, we eat vegetables. And 91% said, of the vegetables we eat leafy vegetables. Where they bought the vegetables and what type of leafy vegetable they ate. Remember the levels in Tanya that I shared with you? And so we wanted to see whether those levels were a public health concern and what it is that would mean from a public health perspective. Now, what it is that would mean is I ate Tanya as a child growing up. It is a very soft, smooth, leafy vegetable, and it's ideal to give as a first vegetable to a child to 6 months old or so. And so the vegetable of highest concern what is the chosen vegetable to be consumed by infants. And so you could see how public health, and in this case, particularly environmental health, is so crucial as a discipline to help identify very early on the safety of food and why some pesticides are being used to help increase the yield of that particular vegetable, because that's the demand that they have. So public health is about not only interventions, but it is about early detection, and ultimately prevention at the earliest possible time. And we found specifically this happening in the rainy season where pesticides were being used more. So why public health? I'm not a good drawer, so imagine this is a one-dimensional home. It's a house that we're building. Most of the money, including to One Health, is at the program level. So HIV, infant mortality, MCH stands for maternal and child health, disasters we all know about. But we cannot address One Health, as we started the conversation, in isolation of the floor of the house. Now, what's in the floor of the house? What's in that black um, part of this drawing? That's you, beginning with you. That's you, our students. That's you, our community. That's you, our public health profession. That's you, are all the professions. Whether you're at Delphal or Pittsburgh, and whether you're in health or engineering, or AI or computer science or whichever field you are, we want to make sure we have enough of you and you know enough to be able to work in this setting. So workforce competency is very important. The next very important thing is where you work and how you do your work. And then the third most important is what do we do with all the data that we have? Are we really using One Health data in a transdisciplinary way to address real world problems, whether it's in humans, in animals, or in plants? Now, I already mentioned the importance of surveillance and the things we do in public health as epidemiological investigations and our ability to work in the lab to find out what's going on, whether it's in a plant or in a human or in an animal. So creating the floor of the house and the dining room and the living room and the kitchen of the house is critical to support all that we have in the roof of the house. So through the National Academy of Medicine, we asked 35 professionals what they thought we should really have, people should know, students should know, and this is what we found. We wanted to know what should be in that One Health framework, and what should people know, what should students know, what should we collectively know. And so here are some of the data, and to Professor Hoyt's point, here are some of the things that the experts, and I was humbled to be part of it, no, and also the Dean of the School of Veterinary Medicine at Penn. And so this is what we found. We needed to also know the drivers of health. We needed to know environmental health. We needed to know about the impact on zoonoses. We needed to know the impact on food security and food safety. We needed to know public health, both from a health promotion and harm reduction perspective. We absolutely need to know about agriculture and food and policies, societal, climate change, how we engage with our community members, and perhaps there are community members on the call today, on the webinar today, and how, that's where we started our conversation, how do we translate what we've learned into action? I want to make sure I go a bit quicker here. I also wanted to Professor Hoyt's point, wanted to make sure we look at this not only from a local perspective, but from a global perspective. And I'm just sharing with you what global health learning objectives are as you do your studies. We talked about surveillance and the importance of surveillance, both in humans, in animals, and in our ecosystem. So when we look at One Health, it's critically important that we connect seamlessly science, policy, and practice, because science helps us apply the evidence into policy. But at the same time, science also helps us to address risk, to particularly decrease the risk for people on the front line, for animals that are close to us, and ultimately how practice then, how policy influences practice in terms of implementation. You heard about our Pennsylvania One Health Consortium. I'm so proud that each of us in all of the academic institutions in the state of Pennsylvania are partners And from the educational perspective, Professor Hoy Delval is leading that for us. At Pitt, we're leading the research one, and together we're leading policy and community engagement. Lots more to come about what we're doing on the One Health Consortium. I'm going to do some shameless advertising on June 26th to 28th. We are holding our first annual meeting of the consortium in Harrisburg. So stay tuned. I'd love to see all of you there. And then I want to tell you what students are doing. This is a field visit by our students in the climate and health course. We went to a fully sustainable farm near in Cortland, the Cortland Dairy Farms near Harrisburg. And so what one of the professors is holding in his right hand is actually dried manure. And so that manure that is dried and is now being used as kind of as bedding for the cows. And then my last slide is that I want to show you what I'm doing, where I bring students where I used to practice in the Amazon rainforest in Suriname with me every summer. We're going in May again to address the One Health challenges to turtles, to sloths, baby sloths, because of deforestation, and yes, they take the bottle, to a special habitat of the dolphins. And you see one of the students in the middle planting mangroves to go against coastal erosion. The top left, you see their loss of land at the Atlantic coast. Thank you, and I'm looking forward to your questions.
Thank you so much, Dr. Lichtveld. Everyone, please put your questions into Q&A. I'll try to kick us off with one question. So talking about, all the data that you've been providing related to public health reporting, in surveillance of diseases, we really are looking at this from a transdisciplinary approach, aren't we? So we need entomologists, we need wildlife folks who are also there looking at potential vectors and those that may be kind of the best candidates for looking for potential diseases coming down the road, and then trying to get this information across to people in the public as well. Certainly the consortium is one way of kind of transmitting this information. What are other ways of trying to keep people in the loop as to all of the information that's coming from all these different directions?
So one important advantage that we have in Pennsylvania that I can safely say no other state has is that, one, we're working together through that consortium. We are dependent to some extent from the federal government to provide us the surveillance data from not only from Centers for Disease Control, but to your point, from the FDA, from the USDA. But we in the consortium have the expertise to take all those disparate data sets and make them meaningful so that we can work together on using the surveillance data to be ahead, to predict where we have increased cases so that we can provide education and awareness. And we really need partnerships. We have to have partnerships with our communities and say, do this, do that, make sure you wash your hands in the case of norovirus, or make sure you wear long sleeves or long pants when you go into the woods to prevent tick bites. And so those common messages, those common protective efforts can only be done and can only be as good enough, one, if we collaborate with our communities, and two, if we collaborate amongst ourselves to analyze the data.
Great. Well, we have some questions. And so first question is from Anonymous. How would you go about convincing farmers not to sell raw milk anymore?
That's a tough one. That's a policy one. And as you saw in our diagram, policy is one of the 4 areas that we're going to focus on in the consortium. So policies are developed at the federal level, but also at the state level. So if the federal level says that selling raw milk is not protective of public health, or if you're selling raw milk, you must have very big on the front of the packaging to boil it before you drink it. That would be a first good public health step. And then at the state level, the state can say we will not allow that, but often federal rule overrules the state rule. So an easy step would be to have labels on each of the canisters saying you must boil it before you drink it.
I particularly liked your little diagram of the triangle with science being at one end of it, practice being another corner, and then policy. One thing that I know when I was in university, we were often talking about that scientists should not pass on any information or shouldn't tell policy what they should be doing. But then again, we have a responsibility as we gather data and we analyze data, passing that information on and making suggestions for policy change. And I think that's been a big change that I've seen with more of the discussion of One Health, that researchers have to take an active role.
It is our responsibility, and I can say I am so pleased about our Department of Agriculture, who is so willing to collaborate with us and who's eager to get our advice to inform policy. We as scientists, we as professors cannot make policy, but we can certainly inform policy by providing the data and interpreting the data for those who set policy and set regulations. In our case, the Department of Agriculture, the Department of Health, to work together.
Another question from Anonymous. Are there any up and coming illnesses we should look out for that you didn't mention?
So I did mention the flu. There are actually several viruses and bacteria going together currently in the spring, and that's why protective measures are so important. So the flu is there. There is still COVID, RSV, and norovirus. The rates are particularly concerning. And so we want to make sure that we take protective actions, whether it's masking, whether it's isolating, whether it's washing your hands. And so we always should be on the lookout for other diseases that exist on top of the non-communicable diseases that already are there in anybody. There are people who are on immunosuppressive therapy. There are people with hypertension, people with obesity, people with diabetes. And so if, let's say, for example, there is a disease that impacts the lungs, and like the flu, and there is a person who already has chronic asthma, or a child with childhood asthma, then that impact is much more severe than someone who has healthy lungs. And so it's not only the type of disease, but what the state of your immune system is. How strong is your body to be able to survive the impact of the disease? And so that's why, just like at One Health, we're looking at our health as not a disease-specific element, but holistically as a how, and that's why health and well-being. And I didn't talk about another disease. Thank you for giving me the opportunity to do so. I am very worried about the stress and mental health, particularly in our young individuals, in our young students. This is a time where there is heightened stress. There was heightened stress and psychosocial impacts. For example, during the pandemic, when students couldn't get together, come together, had to stay indoors. I am worried about that right now with the impact on climate, particularly from climate, on our health.
We have another question from Kathy. Given the political climate, what kinds of actions can we take as individuals to support the science and the need for public health messaging that is accurate and impactful?
Not a difficult question. Public health is the neutral broker of science, meaning that we always we always make sure that there are facts and facts that we can translate, facts that we need to communicate. So in this period, it is critically important to actually over-communicate. It is critically important that we exercise our individual rights or individual ways that we go about it, but it's also critically important to protect our communities. Just like with herd immunity, we're not just 100,000 or millions of us living in Pennsylvania. We're one Pennsylvania, one community. And above all, it is so critically important to have unity at this point, and stay true to the science. Science is nonpartisan. We need to make sure we continue to develop the facts and communicate the facts. That's what's so critical.
I had something that came to my mind, Dr. Lichtveld. You know, we've recently seen an article come out, and this kind of makes this connection between wildlife and the environment and public health. And so back in around 2007, we see a brand new fungi that appears in the United States, starts impacting our cave-dwelling bats, particularly across the northeastern part of the country. This is now spread to Canada and to other parts of the United States as well. In many cases, little brown bats, we lost over 95% of the animals in our region. That used to be the most common species I ever saw as a young budding biologist, and now they're considered quite rare and being considered for the endangered species list. The loss of these bats very quickly, in my mind, it was obvious these are insect eaters and they have an incredible role in ecosystem services as arthropod suppressors. And so with the growth of pest species in agriculture, we saw that increased in pesticides that you spoke about. And in turn, we've now seen an increase in infant mortality that has been linked to this as well. Again, it's a One Health problem, isn't it? We've got to bring all of these things together.
And I couldn't have tracked how it went from fungi to bats to having more insects and more factors to infant mortality better than you just did. And so when we think about now, why is it that there were more fungi? Is it because the temperatures are warmer? Is it because bats traveled further to find food? Is it because we have both drought where bats need have more of a more sustainable environment? And so we need to be willing to not only address the symptoms, but we need to be willing to address the root cause. And it doesn't matter to me whether we want to call it climate or climate change. What matters to me is we need to address the root cause because the impact is on each one of us. Thank you.
And I think our final question here is from Grace. What amount of time between disease qualifies as a back-to-back pandemic? And how long does it take to bring back our immune systems, specifically with COVID?
There is no set amount of time. It all depends on how fast, as I mentioned before, how easily is the virus transmitted. It could be the same virus we've seen before. It could be a different strain of virus, as we're currently dealing with the highly pathogenic avian influenza. And how the critical piece is how quickly the virus can change its makeup. You know, how quickly can I change my jacket to fool our immune system? And if pandemics, if those transmissions happen very quickly without giving us as individuals, but also us as a community and the public health infrastructure, that system, that's that army that goes on the front line to help protect us and intervene. If we don't have that period to catch up, so to speak, then we're going to do worse with the next pandemic. And that's why it is so important to not only do the surveillance and do the monitoring, but get us ready, prepare us to respond. Therefore, it worries me a lot when support for public health, and particularly support for the infrastructure and the people who work in public health. I spent 15 years at the Centers for Disease Control and Prevention before I joined academia. If my former colleagues are not equipped and not able to respond as quickly as possible with the technology and with the knowledge that they have to prevent that next pandemic. It's really the time, the inter-disaster period, whether we call a natural disaster is a disaster, a pandemic is certainly a disaster in my books. It's the inter-disaster period where we need to put all of our resources and all of our attention to. That period is right now, and we don't have a lot of time. So we better focus on what's our number one priority is get us ready, trying to prevent that pandemic to occur. And if it is going to occur, be ready to respond, and particularly be ready to respond to those who need it most, to those who are most vulnerable, whether they're kids with childhood asthma or aging population.
Great. Well, we are at our time, and to be respectful of your time and everyone else's, I'll be ending these webinar at this point. But thank you so much, Dr. Lichtveld. Do you have any kind of closing comments that you would like to make?
I'm delighted that I could join you. I'm hoping that all of the students and all of the other audience members become part of our public health army, so to speak. And I'd be happy to talk more and see what you can do individually to protect our communities in Pennsylvania and around the world. Thank you. And thank you for your leadership.
Thank you so much. Everyone, I hope we see you at our next One Health seminar and all of the ones after that. We hope that we'll bring you some interesting topics and great speakers like Dr. Lichtveld. Good night,
Thank you, everybody. Bye.
Good night.